good morning. And we know that there are others who will be joining us as they jump on their Zoom lines. My name is Liz Baxter. I'm the CEO here at North Sound Accountable Community of Health. And I'm just so appreciative of the team that has brought this panel together and for the panelists joining us today. So thank you all so much. A couple of housekeeping things before we get started. We are going to ask you all to put your name, your pronouns, your organization in the chat box. We use the chat box throughout, so as ideas and questions and comments come to you, feel free to put them there. We'll have folks on our team that are kind of watching that so that we can come back and circle through awesome insights and questions that come up. If you can, keep your camera on, and just knowing like how sometimes internet is a little bit sketchy for some of us. If you need to turn it off, that's okay too. The meeting is being recorded, so we're hoping that if others can't join, they'll be able to listen in after the fact. So I'm going to start with our land acknowledgement. We begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. And on this slide, there's a link that we'll also put in the chat. If you ever just have a question about like whose land are you on, where you went to high school, where you got your first job, it's an amazing site put together by a group in British Columbia that I use often when I'm on the road so that, I can share. Yesterday, I was on the lands of the Still-Squamish people, and today I'm talking to you from the traditional homelands of Lummi and Nooksack. If we go to the next slide, just to talk about what our agenda is today, this is our monthly kind of learning series. We're going to be joined by folks from the Equity Cohort. And then we have this panel discussion that I know is with every session, we're going to wish that we had twice as much time as we have, but talking about how we can reimagine data within our context and the work that we do. We are going to have some breakouts for folks to be able to kind of talk to each other and reflect on what we've heard, and then we'll come back together and do some closing and next steps. So go to the next slide. So just giving a context to how we do these monthly sessions, the Collaborative Action Network is really an opportunity for partners across the North Sound region to come together to learn, to try and find ways to form connections, form projects and initiatives, do advocacy, to try and find just different ways to connect with each other and do work here across this 5-county region. We've had people self-selected into cohorts. They were a strategy in 2022 for the network itself. And it really was a way for us to kind of further partners learning from each other and seeing what some opportunities were that might exist. This monthly learning series is open to anybody in the network. And it's really our way of just continuing to kind of stir the pot on what we can learn and where there are some things that we can do together. We know that folks who are on this call are engaged in different cohorts at different levels, some just for learning, some are actually kind of doing a deeper dive, and some of the partners who are on the call are leading or co-leading the work that's going to be emerging out of this 2022 discussions. At every level, we're incredibly grateful for the participation that occurs. With that, I'm going to transition to Xenia Junkir on our team, who's going to help us kind of get grounded in the approach we've been using and get us started for the session. So thank you all very much.
Awesome. Thanks, Liz. Hi, everyone. Good morning. I hope you're doing all right. And that if you are in the North Sound region or any other region with smoke, you are taking as much care as possible. I know it's really impacting a lot of us. So as Liz said, The network itself is open to community members and partners like you all who are part of cohorts, who might be part of the learning sessions but not part of cohorts. But anyone who is involved in our work really is committed to the engagement of these shared beliefs. So the work that we do is really to try to get to spaces and places where all community members deserve to thrive, where we acknowledge and recognize the inherited legacies of systemic racism and take action towards mitigating and dismantling those systems that we know impact our community members on in every aspect of their life. And we really believe that together we can create new legacies. So as we live into our shared beliefs through the co-creation model of the cohort, through the work of the work groups, through the projects that you all are having conversations about and selecting, and through these sessions in the network, we are really learning about ways and creating these new legacies ourselves. So we really believe that we're accountable to each other and the well-being of future generations, and everything that we do is towards that goal. So these are kind of a reminder of the shared beliefs. You should have seen these in your contract or compact language, or if you've been at any of these other learning sessions before. Next slide, please. So as Liz mentioned, this network learning session is being led by the Equity Cohort, specifically the Measurable Equitable Wellbeing Work Group led by Megan Tripp and Nika Osteen. I am the lead for the Equity Cohort, but really convene that group with the other members, including Megan, Nika, Michaela, Liz, Marco, and our brand new welcome level 3 partners at C3, Jackie and Mateo. We're super excited about this session and about the work that the Equity Cohort has been doing. As a reminder, the Equity Cohort is one of 5 cohorts that works within the network. And then within the Equity Cohort, we have 3 different work groups, the Equity and Racial Justice Work Group, the Tribal and Indigenous Learning Work Group, and then the Measurable Equitable Wellbeing Work Group. Again, it's really has been involved in leading up this conversation here. So with that, I believe I'm going to turn it over to you, Nika, to get us started. So thanks for being here, everyone.
Thanks, Zenia. I am going to moderate the panel today. I'm really excited to welcome the 4 panelists we have. As Zenia mentioned, my name is Nika Osteen. I use she, her pronouns, and I'm the Senior Program Manager for Practice Transformation at the ACH, and work on the Measurable Equitable Wellbeing Work Group with Megan Tripp. A little bit about why I'm interested in data equity. Before I came to work in public health, my background was actually in scientific research. I worked primarily in HIV research and cancer research, so I had a lot of background doing data there. But I really got interested in data equity when I started working with providers about working with LGBTQ youth and why it's important to collect information about those youth and do it in a way that replicates the language that feels good to them. So I worked with the Q Card project based out of Seattle around how do we collect data, how do we use data, and how do we do it using the youth voice. So that's when I got really interested in this work. And I am going to pass it over to our panelists to introduce themselves really briefly, and then we'll get into the discussion. So I'm going to start with our friends in Whatcom County. We'll start with Amy Rydel.
Thanks, Nika. Hi, everyone. My name is Amy Rydel, and I am the Health Planning Specialist for the Whatcom County Health Department. And I'm going to talk a lot more about how data is used in my role, so I'm going to skip over that right now and pass it over to Jason.
Good morning, everyone. Jason McGill, he, him, his, and I am the Executive Director for Northwest Youth Services, which is a nonprofit that serves youth and young adults experiencing homelessness in the Whatcom, Skagit, and Island County areas. And I too will, data, we live in data. We need data points to really understand how many folks are out there living on the streets. So it's definitely important to my role of understanding and how we even collect data. So yeah, but I'll pass it on. More to come on that.
Thanks. And then I'm going to pass it over. We have 2 folks from Portland from the Coalition of Communities of Color. So I'll go to Dr. Lopez and then Dr. Mohsini.
Good morning, everyone. My name is Dr. Andres Lopez. You can call me Andres. I use he, him, and L pronouns. I'm the research director at the Coalition of Communities of Color. I'm here with my colleague Mira, who will introduce herself in a second, but I just wanted to the coalition, tell you a little about the coalition. We are a coalition of 19 culturally specific community-based organizations. We've been around for 20 years. And Mira and I lead the Research Justice Institute at the CCC. And today I'll be talking to you all mostly from our perspective of working with dominant institutions, which we define as governments, businesses, universities, for-profit folks. And then Mira will talk a little bit more about our community research, which we sort of distinguish differently. And I'll let her tell you more about that. Nice to be here with you all.
Good morning, everyone. My name is Dr. Mira Mohsini. I use she, her pronouns. Feel free to call me Mira. I'm a senior researcher at the Coalition of Communities of Color, and more specifically, Andres and I are at the Research Justice Institute within the CCC. And yeah, I'll be talking a little bit more about our work with communities because, you know, the CCC is placed very interestingly as almost an intermediary between dominant institutions and community. And so, as Andre said, we are a member-led organization, and so a lot of our work is member-facing. We don't do sort of direct services work, but we are very tapped into the work that our communities do. And so we'll be speaking about that in terms of how we work with communities to better do data equity and data justice work. So great to be here with y'all.
Thank you, everybody. So I want to start by jumping in with Jason and Amy and learning a little bit about the work that you have done to engage community voice in Whatcom.
Yes, and I will start us out here. Thank you, Amy, for getting the slides up. Before we really jump into some of the work that we've done, I do believe it's important to ground everyone to have a better understanding of our community up here in Whatcom County and why we took the approach that we've taken with collecting data and using community and getting community involved and the whole RBA results-based accountability framework operates. So just to get into it, we are an 86.2% white community. And as we work, it's important to understand that this isn't an accident. It was by historical design. And I want to highlight a couple defining moments for our community. First, the first incursion of European colonizers was by sea in the 1770s, the second by land in the 1830s, during the founding of the Oregon Territory as a haven for white settlers. And the Oregon Territory, free Black or African Americans or Asians could own property and slavery was legal. In 1885, Chinese workers were threatened and expelled from the area. In 1907, mobs attacked South Asians and then expelled them from town. In the 1920s, one of the largest Klan rallies in the US was held in Bellingham, and the mayor gave a grand dragon the key to the city. We have a history of redlining and sundowning that takes us all the way up to the year that I was born, and there are still red lines on deeds in our wealthier neighborhoods. And I learned this when we were trying to purchase a house for our adolescent shelter. These are minors, 13 to 17. We're trying to put them into a neighborhood. And we were trying to purchase a home in one of the wealthier neighborhoods, but we were blocked. So how about that? That's 2022. And being a county with a great deal of corporate agriculture and a border town, we have a history of ICE raids. And there's actually a detention facility within our borders. I'm not sure if everyone knew that, but these are facts. And with the context of the history of the land that I reside on, we're going to talk about how we are doing anti-racist work within a process that is convened and resourced through the local government. And I'm going to pass it to Amy.
Thanks, Jason. I always feel like I want to sit with that for a minute because that's always just a hard slide for me. But I am really, thank you for sharing it. So this is the cycle of community health improvement, which is a multi-year collaborative strategic planning process that's designed for communities. It's not for a single organization or entity. Community health improvement is a best practice for health departments, as well as a requirement for public health accreditation. In Whatcom County, our process is called Healthy Whatcom. And as folks were popping into the chat this morning, it was really fun to see a lot of my Healthy Whatcom friends here in this room. So it's lovely to see you today. Our team members for Healthy Whatcom represent a variety of organizations and perspectives. And we have come together because we want to eliminate inequities that are caused by white supremacy and systemic racism. And we believe in the power of individuals to dismantle the systems and build the community that we want to live in. So historically, large-scale community planning efforts have relied on system providers' input and exclude, or at best, very minimally engage those who are impacted by important community decisions. Throughout each phase of community health improvement, so as we move through all 6 of these phases, participants have been an intentional mix of people with personal experiences of racism or marginalization, and or trying to access the systems that we're trying to change, co-creating and working alongside those with resources and power within the system to make change. We start by completing a community health assessment because Whatcom County is a smaller community. As Jason said, we've got about 225,000 folks in all of Whatcom County. We rely a lot on qualitative data or community stories to fill in the gaps and help us uncover areas or disparities that are hidden by quantitative data. In looking at all of the data in our community health assessment, we started to see a pattern, and that was that across systems, education, healthcare, child welfare, criminal legal, people of color in our community were disproportionately impacted, which means we don't have a people problem, we have a system problem. We then gather over 100 community members together to share all of this data with them and go through a facilitated process to identify the top priorities for our community that no one agency can handle alone. And in our community, those priorities are children and youth mental health, housing for children and families, and early learning and care. So before jumping into action planning, the Healthy Whatcom team looked at each of those priorities, partners, and work underway. And in doing all of that, we realized there was already a tremendous amount of work happening. And all over the community, there were coalitions working on those issues, there were organizations working on those issues. There was just a lot of energy already going into those areas, yet we were not making the impact that we wanted. So we realized that rather than jump right into strategic planning, we needed a new tool. And that brought us to results-based accountability, which is essentially a framework for collaborative strategic planning. Advancing equity is at the heart of community health improvement. It's why it exists. It's why we do community health improvement within communities. So we intentionally designed this process to incorporate learning on systemic racism and undoing systems of oppression before we developed our action plans. So we brought the Racial Equity Institute here to Whatcom County and hosted them for a week. And we had over 400 community partners trained in their phase 1 and groundwater model. So I want to emphasize that RBA, or results-based accountability, is a tool. It's not an answer or a set of steps that must be rigorously followed. It's a flexible framework. And the reason that I say flexible is because we have pushed at it every step of the way to incorporate and elevate anti-racism and equity work. And it's really helped us to focus and move our community forward. As Jason mentioned earlier, our community is 86% white. So our work became not just how to develop our action plan, but how to use this process to center power and decision-making with those who are most impacted. So after having those workshops, we then went through this process to develop our community health improvement plan. Oh, I apologize. I accidentally hit the link to open our website. If you want to go to our website, you're more than welcome to. All right, so now I get to talk a little bit about how we're using data in community health improvement, a little bit more than nuts and bolts. So before we look at quantitative data, we start by providing themed and visualized qualitative data from our community health assessment, as well as several community listening sessions about racial justice that were held throughout Whatcom County. And that really helps provide context when we look at our quantitative data. It also helps us see areas where our quantitative data may be saying that things are looking really great, but when you dig in deeper and get into that qualitative data and those stories, we realize that there's quite a different story being told. And so it's really important to look at those pieces together. So this is a sample of the data that we used at our first community planning workshop. It's kindergarten readiness by race and ethnicity in Whatcom County. And one of the reasons we really like this data point is definitely not because of the numbers that it shows, but really because of how important it is to disaggregate our quantitative data or really pull it apart. So in Whatcom County, about half of all children enter kindergarten ready to learn across all 6 domains. That's physical, social, emotional, cognitive, language, literacy, and math. But when we look at this by race and ethnicity, we see that children of color are about half as likely to enter kindergarten ready to learn as their white peers. And I'll be the first one to tell you that data is not perfect, and one data point doesn't tell the full story of a child's experience. But kindergarten readiness is the most widely used data point in Washington state to understand what experiences a child may have before they enter kindergarten. So after looking at kindergarten readiness data, we do a factor analysis to dig into what's pushing that data in good and bad directions. And before beginning, a participant asked our community how real we were going to get in this work. That participant was none other than Jason McGill, who I'm pointing to in my screen. He may not be above me in your screen, he's above me in my screen. And Jason now sits on our planning team. And with that charge, we started with the question, twice as many white children enter kindergarten ready to learn compared to children of color. Why? And in our factor analysis, the community of about 144 different community partners identified over 250 factors or small stories that were pushing our kindergarten readiness data. And that's in RBA called the story behind the curve. The Healthy Whatcom team organized all of these factors by themes and grounded ourselves in our call to action for this work, which is our commitment to doing something different that's grounded in anti-racism and to go after the systems that work together to produce the poor outcomes we see, which we refer to after our work with the Racial Equity Institute, the groundwater that's poisoning our community. So we then developed groundwater statements that our community developed strategies around, which became our community health improvement plan. And there's a lot of words on this slide, and I'm certainly not going to read them all to you right now, but what I do want to point specifically to is that in all of this language, the focus was on naming the disparities in our community. And that's the story behind the curve for Whatcom County.
All right. So where do we go from here? Remember earlier when we said that RBA is a tool, not an answer or a rigorous set of steps. In Healthy Whatcom, we recognize that how we do our work is of equal or greater importance than what we're doing, meaning it's the processes we build, who holds power and makes decisions in spaces, how folks impacted the most are engaged and honored in the work. In anti-racist work, we are not empowering communities. Our community is powerful. It's full of wisdom. So the work becomes how do we address systems perpetuating inequity and actively shifting power to our communities who have been historically excluded or marginalized. Again, this community in Whatcom County has a deep history of excluding folks who look like me to furthering and developing a community that everyone belongs to. Here's a short list of some of those intentional shifts: establishing stipends to financially honor the participation of people with lived experiences, explicitly agreeing to guidelines for doing anti-racist work, using clear language that calls out white supremacy and racism, naming and working through power imbalances. Example, executive directors working next to people who are accessing services through the system, positioning BIPOC people as leads, facilitators, organizers of the work, asking BIPOC people how the work could be more anti-racist and acting on those recommendations, and also encouraging white folks to do the work themselves, purposely having breakout rooms for BIPOC people to meet and share perspectives, white allies consistently engaging in self-reflection and changing to do better. When you know better, you do better. Shifting focus from individual behavior and characteristics to build accountability for community-driven solutions. While selecting our strategies to address in our CHIP, we were going through the can't talk this morning, sorry, going through the rigorous voting process when we had a moment of clarity and true allyship in our meeting. And for those of us on the organizing end of things, what we love call is a blow it all up moment. Let's just blow it all up. Our system folks asked our BIPOC participants to share what strategies would lead to transformation in their lives for their children and their communities. Storytelling, which was important to the process. Those were strategies that we all agreed to move forward into action planning. And what's next? We are about to enter in what I think of as the most challenging part of the work, acting on our CHIP. A lot of times we talk about it, but we're not about it, meaning we're not about action, knowing what we need to do and doing it. At this point, it would be so easy to step back and hand the work over to the housing, early learning and care, and child and youth mental health systems to lead. But how do we continue to co-create with those most impacted? After consulting with experts from the Poverty Reduction Work Group in Washington State, who developed a governance model to center community members with lived experience, we recognize that we need to do the same within Healthy Whatcom, and will develop a model that redistributes decision-making power to community members. Something that we want to launch and we are working to secure resources for, again, we're working to secure resources for, as a BIPOC-led data action team to act as a governing body within the Healthy Whatcom Coalition's equity framework to ensure those disproportionate represented in the data are centered as experts in their experience and are crucial partners in co-creating solutions. Current data processes replicate inequitable housing systems and resource distribution. Northwest Youth Services is shifting to healing-centered policies and practices. We recently launched a Cultural Impact Committee, CIC, which is an internal advisory body designed to update structures and processes to dismantle the systems of oppression perpetuating youth homelessness. However, as direct service providers, we have limited capacity for system level work. This work never gets funded, at least since I've been doing this work, which is why we still have homelessness. The data action team and CIC will pilot in partnership in an assessment tool to analyze for anti-racist policies, practices, and structures and make recommendations for changes, including the distribution of resources. This partnership ensures that organizational policies and procedures are anti-racist and focused on community conditions that lead to an equitable housing system. And I will pause there.
Thank you, Amy and Jason. I know I'm really excited to hear about what you learn as you redistribute power and pull together this data action team. I think that sounds like really important work, and I know you're still in the initial phases, so I hope we can continue to learn together and learn from you. And I love how, Jason, you called out that moment where you realized like we need to blow up the system, and I think that's really important. So thank you both for sharing. I want to pass it over to Andres and Mira to talk about the work that you're doing in Portland and what excites you about the work that's going on in the broader movement for data justice.
Thank you. Yeah, I can get us started here. So what we've been doing in Portland is we sort of have two approaches to our work. One is, as I sort of hinted towards at the beginning, was that we help dominant institutions do data equity work. And so in many ways, that looks like helping dominant institutions understand about their surveys, their tools, their measurements, their approaches, right? All the ways in which they attempt to do data equity differently, but need support in understanding how to do that. The other side of that is the community side, since we are a member-facing organization, not a community-facing organization. So we spend a lot of time working with the community-based organizations and their understandings of data and their perspectives of data and their needs for data. So I'll talk a little bit about the dominant side, and then I'll have Mira talk more about the community side. But we also split these two things really intentionally because we do think that they are coming from different perspectives. We do think that when the dominant leads, that they are always limited in their frame of action. That's directed within their boundaries, within the metrics that they rely on largely. And because of that, that equity approach will always really be shaped by the dominant to some extent, regardless of how much community is a part of that process. It's still within the boundaries of that dominant approach. For our community members, there's not that sort of boundedness, right, or limitation on what's possible for what they imagine. So those all often lead to more justice-centered approaches because community members are reimagining and thinking how to dismantle these structures, not just make them more equitable, right? So we see quite a distinction between those things. And that's why we sort of separate our work in many ways from dominant to community. And we're in this messy middle part trying to understand, where do they support each other? Where do they align? Where do they overlap? How can they bolster each other, right? Not necessarily that, you know, one is bad and one is good, but that they are in different, in support of different directions and different strategies, right? So for some of the examples I'll give you for the dominant, right, is that I was just thinking, Amy, about the comment you made about that data point, that it's the most commonly used metric, right? And I think we often talk about the limitations of these metrics, but yet we still give them so much value because they're the most commonly used, because they're the ones within our systems that have dominated the discussion for so long about how we measure equity, right? And so I think, again, this is a good example of how when we begin with the dominant, we're coming from that place of trying to make that measurement better, more holistic, you know, deeper, but we're still starting from that place, right? When we work with our community members in a survey modernization process, where we try to modernize the surveys that the state asks of community, our community members would never ask that question. They don't think that question's even valuable. And in fact, we've been spending a lot of money for many years asking the same question over and over with getting very limited strategies on how to do things differently, right? And I think what Jason and Amy are proposing here and what they've done, they've gotten a lot more nitty gritty on the actual actionable steps to take moving forward, right? But that's not traditionally what happens when we lead from that place, right? So sharing that as an example, some of our community members may not even see the value of that. So maybe, and it's not blowing it all up, but it's saying, why don't you ask the question differently? Or maybe what you're actually trying to get at is this, right? And so community is really good at providing, you know, better questions, more actionable questions, questions that get us out of, you know, this sort of grand tracking approach of a certain ideal, right? That doesn't actually have solutions, that just tracks deficit, right? And get us away from that, thinking more about, well, what's the action? What are the things that need to change, instead of this racist variable that continues to define our communities over and over again, right? So that's one example in which you know, that dominant equity work often is not necessarily aligned with how community may approach it, but when community is a part of that, we can get much better understanding of the limitations of those metrics, why we need to be pushed in different directions, what have you. The other bit I wanted to say was also thinking about, you know, we work a lot with dominant institutions to challenge their their sort of quantitative supremacy in how they make decisions, right? That everything has to be measured and quantified for us to really say that we've created change or that something has happened. And one of the things we do a lot with dominant institutions is say, that's great. You should measure and quantify how much affordable housing units now exist within our region, right? But we also need to qualify that, right? How good are those units? Are they actually going to be units that people can stay in for a long time? Does it support people from different cultural backgrounds, right? Like how are the nuances and how a product or reality is delivered or situated within a different group or in a different context? How are we qualifying those things alongside our quantification of them, right? So we're doing a lot of helping dominant institutions to both quantify and qualify, which of course, like the examples that Amy and Jason gave, were really sort of centering qualitative data and really trying to get in more of those actionable, contextual and structural pieces. And then I'll say something quickly about evaluation, just because I think I need to say this, in that there's always this pressing need to evaluate things in a certain way with certain metrics, with certain standards. And that is often imposed on communities, right? So we say, oh, we have this great opportunity for you, community. We have all this money. Help us understand how to spend it, how to do it. But then you need to track it and measure it in the way that we think needs to be tracked and measured, right? And oftentimes our community members are not in the position to do that, and it doesn't really honor them. And Mira will talk a little bit more about that, but I just sort of wanted to set that up because we're often having these discussions about co-constructing what should be evaluated and why and how. And a lot of times dominant institutions really struggle with that because of their need to report this back federally, or just the way that they've done things for so long, right? That they're like, oh, that's what our board or our leaders think as real evidence for change, and we can't divert from that, right? So we work in a lot of ways to try to help the dominant understand that, yes, you can push back. Here are some good approaches. Here are some good strategies. So I'm going to pass it over to Mira because she's got a lot more to share about the community side and sort of what we're doing and how that's filling in some of these gaps.
Yeah, thank you. I'm reading a lot of the chat comments, and they're really great, and I hope we can have a chance to get to those at some point today. Yeah, from the community side, I wanted to just open up that conversation by just sharing and centering the importance of relationships, because what we know about working with our members, community-based organizations, is that they have built long-standing relationships with community members, and they have everyday interactions and exposure to community members and understand very deeply their needs and desires. And through that interaction, through that closeness with community, which of course dominant institutions just don't have by virtue of their position, their power, their mandates, we are very clear that that quality of exposure that our member organizations and CBOs have with community results in inherently very, very, very good data. The issue is that often we, and by we, I mean researchers, but also dominant institutions that often engage communities and community-based organizations themselves don't see the quality of information, the quality of knowledge that they have about communities as data. And so this becomes one of our big roles as conveners and facilitators of community, to really provide that framing, that language of why the knowledge that they have of community is so important and why this is data. We call it community data, right? And why it is just incredibly important for us to find ways to organize this data, to find ways to collect this data responsibly, to share this data responsibly, to use it, right? Like all of these things are very are part of our work and are part of our understanding of data. Inherent to that is we take what we call a tools for tools approach to data and to research. So what that means is that when we think about working with community and when we think about what knowledge they keep, we are not in the business of approaching community in an extractive way. We don't say like, let's tell us everything that you know, and let's then like package that in a way that is understandable or translatable for the dominant. That's exploitative, that's extractive, and that's the typical way, right, of doing community engagement, of working with community on the terms of research and data. And we reject that. And our tools for tools approach is really about is about, of course, co-constructing any kind of research process, methodology, ensuring that is meaningful, right? That the questions, or even the thing that we're proposing, whether it's a research project or whatever it is actually meaningful, that community members desire this, right? And then, of course, collaboration, yes, is important, but also then what are we doing to build a relationship, that relationality? What are we providing as they provide us with their expertise, with their knowledge? Then what are we offering to community? And that could be capacity building, that could be training, that could be, of course, yes, compensation is without doubt needed. But like, so what does that exchange look like, and how can that exchange be meaningful in the context of research and data? I wanted to also think about, offer some reflections, recommendations for our learnings around advancing research and data justice, right? We use that term, as Andres was saying, because we have this understanding, this clarity around the differences between equity and justice. And when we work with community, we want to really support community in building something that is meaningful to them. We want to support community through research and data in a way that supports self-determination, right? That supports the things that community desires. And I also just want to say something about the language of desire, because I think this is important. We often approach research with communities, and particularly communities of color, around disparities research. And that's important, yes, of course, we need to understand the inequities that exist, but we often do that at the expense of understanding desire. What do communities want? What is it? How are communities articulating and sharing their desires for like a life-affirming future? These are things that don't show up in disparities research. And so we really want to center desire-based research. And I want to shout out critical Indigenous scholar Eve Tuck, who really provided us the frame. And I'll drop the link to her piece because she writes about how we cannot understand community through understanding just communities as damaged, right? We want to understand this desire, and this is so inherent to the way in which we do data and research justice. So I'll just offer a few things. One is, we've learned that in doing research with community, that community members have often told researchers, have told those in dominant institutions that are doing the community engagement that, that they've told us for years often what they want, what they need. And yet we keep going back to them and saying, what do you want? What do you need? And particularly in the context of COVID, particularly in the context of the uprisings following the murder of George Floyd and Breonna Taylor, right? Like this really got very centered, that we can't keep going back to community and doing the research and doing the engagement. We need to take stock of what we already know, what they've already told us, because in their stories, in their narratives, we get a great deal of understanding. The problem is that we don't know how to, we're not taking those stories, we're not taking that language and really understanding it, right? We don't have the tools. And by we, I'm mostly thinking about dominant institutions, but we don't have the tools to really understand what they're saying. And so taking stock of what's already been said is really, really important, what's already been shared. We really want to avoid or build, not just rely on these feedback loops that are point in time. This is also really, really important, because often we approach research, community-centered research, by designing it in a way that there'll be these point-in-time feedback loops. this is a good start. I'm not saying like don't do feedback loops, but it often tends to actually decenter community. We think it's centering community, but I think it tends to decenter community because we are still leading, right? We are still setting the questions, we're still setting the agenda, and we really need community to tell us what is most meaningful to them. How should we even design the process to begin with? What are the good questions we should ask to begin with? Just looking at my notes for a second. And I just wanted to say something that Andres mentioned earlier is like the power of qualitative data and stories and narrative is really something that we're pushing for, both for our, again, like for our communities to understand, and the community-based organizations that serve our communities to understand that the data that they have, the stories and the narratives, and the folks that engage with communities, you know, the story keepers, those stories are incredibly powerful because they tell us about they point to structural realities, and this is often sometimes missed when we collect qualitative data, that we tend to take little like quotes here, maybe do a bit of thematic analysis here, and what communities is telling us really do point very deeply to the structural barriers, the structural inequities, the structural realities of what they're telling us. And this is when I say, like, we're not really understanding what community is telling us because we're not seeing those stories as valuable. And as we often say that, you know, stories are supplemental to quantitative data. So again, like what Andres was saying, like we work in a way that really does privilege the quantitative and the qualitative, and the storytelling is supplementary to that. And I think I've taken up too much time here. I'm happy to talk more about it, but I'll pass it back.
Thank you both. That was super great. And I'm definitely taking notes, like desire research, quantitative supremacy. Like, these are such important points that I really want to dive in more and think about with my own work. So I really appreciate everything you've shared. I do want to make sure we get some time for breakouts. I know that people always find those really valuable. So if each of you could just take a minute and give some final reflections on, as you've done this work differently than we've seen it done historically, what are the benefits you've seen and why has that been important to you? So I will just popcorn it the same way. Amy, Jason, Andres, Mira.
Just before I get to that question, thanks for asking that, and then I'll pass it to Amy. I think you were about to unmute. Zania put something in the chat, and I just want to like highlight that. When I talk about like dismantling or blowing the system up, that what I'm talking about is being creative and building the kinds of structures and systems and conditions that create healing and health in our communities. That's exactly what I'm talking about. Like at Northwest Youth Services, our whole model of care is centered or built around Dr. Sean Generate's work of healing-centered engagement. So I just want to make sure that's clear for the group here, because I saw a couple comments about blowing up the system, and I just want to make sure you understand what I meant about that, because I do think it's important to make sure that we're all on the same page with this work. And another point that I wanted to say is that the lens of holding the lens, I don't know how many folks are in this call that works directly with folks experiencing homelessness, especially folks who are young people experiencing homelessness. And the delicate line of like hearing their stories while also trying to work within the system of when you're in a very conservative community. Again, that's why I brought up those data points in Whatcom County. It's challenging, right? Because you do hear, how do you like get to the root cause of intergenerational poverty? It is hearing stories, right? But then it's balancing out some actually concrete numbers that a lot of white folks in this community really drive themselves off. And I hear what you're saying, Andres, like, and Mira, like I totally agree with what you're saying. And the stories alone will not get this community to move forward. It's unfortunate, but it's not. And you will never end poverty if you don't address the root cause of hearing people's stories of why they're experiencing poverty in the first place. I really believe that. That's my work. I'm on the grounds often in this community, working directly with young people. And that's just the world that I live in. So I just want to make sure that that was clear in my presentation as well. And it's not perceived anything different than other than we need healing. Healing takes storytelling, and healing takes numbers. Here, seeing concrete numbers of how many people in this community actually experience homelessness. And one data point that I think is really important, because I don't think it resonates with folks in this community as deeply as it does me, but 1.3% of the population here is Black, but yet we represent 4% of the homeless population. That to me is unacceptable. So stories, data points, whatever, to me, it's just like, it's out the door, because we've already seen the stories. We hear the stories. We hear all of that. We see the numbers. But until we address people's fears around homelessness, why people experience homelessness, will never change. And that's what I mean about blowing it up. So just wanted to be clear about that. Not to be on the defensive, but I just wanted to like really be clear about what I'm trying to communicate here, because I think this community is ready for that. But we keep talking about something and we're not putting action behind it. So
Thank you, Jason. I really appreciate that.
And I did forget your question, sorry.
Oh, sorry. I just, as you're doing this work differently, what benefits have you seen? How have you seen that benefit yourself, to your community differently?
That's such a great question. I mean, I feel like this could fill an hour really easily. I think something that Andrea said earliest that was that really resonated with me was the dominant leads are always limited, like the dominant lead organizations, and coming from the government, right? Like, I think that being able to just name and own my own limitations, and then building processes and building relationships with community, that was something that Mira was saying, that was like, it just holds you to a different level of accountability when you have relationships with people, when you are day in and day out working alongside one another. So I think that, like, I think the benefits that I have seen is that it's so easy to glorify data and to talk about data and feel like you're actually doing something in that conversation, and then not hold ourselves accountable to what comes next and actually acting on that data. And I think by organizing the work in this way, by focusing on relationships, by centering who gets to make decisions and who holds power in spaces, and doing that with a lot of intentionality, is holding us accountable for actually acting on the data that we're seeing and using our energy to move work forward instead. And then the other piece that I'm really excited about, and we're getting ready to do our next community health assessment, and I think about how are we designing that process from the get-go in this way, where we're co-creating with community and really thinking about that switch that we're talking to earlier, about moving from this deficit base to an asset base, and really what does that look like in this process. And I'm really excited to dig into that, and really glad that that came out in the space today, and just very appreciative for this conversation. It's really beautiful.
Thank you. I'll jump in next. I appreciate your clarification, Jason, and I think it's even furthers my point, in the sense that that's still the approach that you're outlining here is so important. You're absolutely right. That's why we work with the dominant. But even that approach, it's still grounded in convincing white people that things need to change. And that's good. We got to do that. But also our community members organizing, they're not building their futures based off of convincing white people that things need to change. They're building their futures off of the futures they want, how they envision it from their communities, from their perspectives. And that's a very different thing, right? And not that they cannot be aligned, or they can't support each other, or that one's more valuable necessarily than the other, right? But that they're distinctive, right? That it's still that approach. So I wanted to uplift that, because I'm not trying to devalue those approaches by any means. The only reason we're even in this critical conscious space that we're in is because we've been doing that work of convincing white people that racism is real in Portland for a long time. And we've gotten to a place where we're further along, right? And that may not be the same in your community, or that, different demographics, different dynamics, different histories of that. So I totally believe in both approaches. It's just the conflation of the two that feels frustrating. And I think we've heard that from our communities, where they're like, no, 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 we're not starting from your point. We're starting from a different point, and that's okay, right? They can both exist, and they should both exist. So that's kind of what we're doing. And the one final reflection I'll offer is around reflexivity. Mira talked a lot about this baseline of knowledge, but one of the things that I feel is most important about relationship building is that when I tell you something about me, or that something that matters to me, or the way that I want to be, and you take that in because you're really listening, and then you act on it, that's the stuff of a good relationship. That makes me know, like, you know what, Amy's listening to me. She actually has my back because she heard me and she's doing something about it, and she's being honest about what she can't do. That's the relationship that we need with community around data, right? That we are really hearing you, we are tracking it, we're being honest about what we can do with it, and we're acting on it. And we're also keeping track of the stuff we couldn't act on, or that was out of our power, but we didn't let go of it. We didn't just say, oh, well, we can't fix all that, right? We're still holding your truth. We're still holding that and being accountable to it, while being honest in our position. So that reflexivity, right? Reflection and action put together. It's a simple way of defining it, but that is really, really critical for data justice or data equity efforts. And I'll pass it to Mira.
I guess the thing that I will add is, from our perspective, we are really very intentional about centering, again, what we're calling community data. And this is, of course, yes, it's the bulk of what we think of as community data is going to be the storytelling and the narratives and the qualitative data. But of course, we know, and we have known, we know that our communities gather information in a multitude of ways. It could be via numbers, it could be quantitatively, it could be via art, it could be via song, right, dance. All these are valid ways of better understanding community. And yet we recognize that we operate and we have inherited a world where there's a hierarchy of knowledge, that many knowledges have been subjugated. We're working in a context of subjugated knowledges that are not valued, that are not collected, that are not, that are not interconnected to create that power building of knowledge. Like they've been devalued, underappreciated, divested in, erased. Like the violence of the context in which we're operating is really important to know. And I just will say that, like, we're working on really thinking about how can we really put out into the public our vision for community data. And in order to do that, we really need to be clear about the limitations of dominant data. And we also need to be clear about how we got here, how we got to a place where we have this hierarchy of knowledge, where we have so much, where we do have these subjugated knowledges. And what do we do about that? Because we know inherently, and I think we've been saying this this morning, is that there is inherent action within those knowledges. There is, and we just don't have a way we don't really have a way of understanding it, of organizing it, of I'll just stop there.
Can I ask Andres and Mira a question? Okay. Fear is like, because this is a conversation, and please cut me off if I need to pause to get to the breakout groups. But when we use the framework of what you all are putting out there, which I love, because I think that that's the tool or the ticket to dismantling fear. To me, fear is that one tool within capitalism. I'm a huge Audre Lorde fan, that really perpetuates youth and young adult homelessness and homelessness in general. So how can we use this framework to break down fears? Because that's my passion right now. Because this community is really built on fears of othering, because that's how we other people. But yeah, we have a wealth of resources up here, a lot of wealthy folks who want to do good, but it's that fear that gets them tripped up and holds them back. Am I asking that correctly?
Yeah, I mean, it's a pretty big question. I do think identifying fear is important, but I guess, if we're thinking of our framework, right, like that dominant equity approach is trying to dismantle fear for everyone in a way where everyone can participate in that discussion and understand that, while centering certain folks along the way, right? And I think that the justice orientated that is not, it's not centering everyone. It's not centering everyone's thought about it. Instead, it's centering those who can speak to it most inherently, most intently, and who have been for generations growing up in a society where they're trying to thrive, even in this context of fear and oppression. So I know it's probably not a super satisfying answer, but I think the approach to how we address fear is going to look different depending on in which arena you're trying to answer that and what audiences. But I do think they can be complementary when communities allowed to develop that on their own terms, not in the dominant. And the dominant can also support ways to do that as well. That brings community into their thinking and their ways of organizing too. And at some point we'll have this beautiful marriage and something will happen and maybe our framework won't be needed anymore at all. But that's what I'll say.
This conversation is so great and so valuable, and I don't know if you all are looking at the chat, but there's really great comments and questions coming in. So if it's okay with everyone, I would like to skip the breakouts and just jump into questions from the participants. We only have maybe 10 minutes left for questions, and I think there's some really valuable stuff coming in. So is everybody okay with jumping into that? I know the breakouts are really valuable, but we're just always short on time. Great. So if folks have questions, if you just want to raise your hand and say that out loud, or you can put them in the chat and I can read them. I saw Ara and Leah both had questions. If either one of you wants to say them out loud, and I'll just call on folks as they pop up.
I just wanted to Leia's point where in the chat they had put the limitations of those who work with data, and that you can have all of these systems in place for working towards decolonization and what they had put in the chat, disaggregation. But if there's no actual support from the people in power, then it kind of puts things in a standstill. Then you can't really you can have all the good intentions in the world, but if those in power don't support you in your organization, then it kind of just stops. So I guess the last question I put in, well, then how can we support each other in getting that buy-in, getting that support, and holding our organizations accountable? Say, if you don't have that power, how can I hold those who do, those in leadership, to be well, you said you wanted to invest in this. I'm trying to put forth these new ideas, but I'm not moving forward. But hey, I have Northtown ACH, I have all this knowledge. How can I from an outside organization support someone else who might be having it? And this might not even necessarily be this forum for that, but I had just seen it in the chat and I was yeah, that's a really big question, and something I'm seeing outside of this as well, just in general. I'm here lower in the organization, I can't get the buy-in. What am I supposed to do? Just give up?
I can speak to that a little bit just because of the place that I sit in my organization. I'm not a manager. I sit kind of in the middle of the organization. And I'm trying to think of how I want to say this, but I think that one of the things that I have really worked on a lot over the last few years is realizing where I do actually hold power, and really thinking about how to bring that into this process. I think about community health improvement and really thinking about the work that we're trying to do and how much you know, in my first year in my job, I had this, like, those of you who know me, you can kind of see I've got these Post-it notes over here. And these are like quotes and reminders. Liz Baxter, you're on here from like years and years ago. Jason's on here several times. Just things that give me sort of courage and things to remember. And my first year, my mantra was find your team. And it was like, find the people who will go there with you and hold you accountable and be messy with you and figure it out together. And really think about who you're accountable to in your work. And then how do you design that, your work, to hold that accountability true? And like, and for me, my work is, it's a community that I'm accountable to. It's for my organization, I have to, you know, meet these accreditation standards, but how I design my work, how I organize the work, who like, you know, how we do all of this together, that's where I have power to do it. And honestly, I've stopped asking for permission. And that's the big thing. This is the way to move forward. And so we're going to do it. And that's it. And I think by doing that, you know, I think about it, it's almost like pushing a small snowball down a hill, right? Where it starts to gather that momentum and get bigger and bigger. And that's what we keep saying within Healthy Whatcom. How do we create something that becomes undeniable? So that when we are in spaces and we're sitting there presenting these strategies, and our community health improvement plan is all about what our community thinks will work, what our community has said will make it better, that we're holding those in positions of power accountable for actually acting on that. And so that's, you know, that's the big thing I would say, is just find your team, figure out where you have power, think about what values drive your work, and then how do you organize your work to do that. And I know that that's seems really simple in some ways, like that's like, oh, and four easy steps. And I'm not saying that at all. I'm saying I know that this is hard work. And just, you know, I think of myself a lot as a convener. And so I just always invite anyone here. I learn so much from talking with other people and problem solving with other people. And I'm always just happy to schedule a phone call and just go into it a little bit deeper. But that's what I would say. Start with finding your team.
Thanks, Amy. I think a lot of people are resonating with that. And I like when you said, I just stopped asking for permission. Liz, I see your hands up.
Hey, thanks, Nika. Can't wait to see what Post-it Amy's got on her board. But, you know, I heard a couple of themes that I guess I want to circle back to. One is, like, we have the data, we've heard the stories from people in community. And I wonder how those of us who are in that middle space get to go to our county commissioners or our city leaders or our organizational leads. And when they say, give me the data, that we don't couch it in 2% of the population is X. And so they're looking at it buried within these global numbers, but that we push them to change their question. If their question is, what are the improvements we need to make in the Latinx community? How do we change lived experience in the Black community? Then it doesn't matter that it's only 2%, because now that's the totality of the sample that we're looking within. And, you know, my team knows I press a lot on, like, are we asking the right question? And I, you know, just for the panelists, because this is probably going to be one of the few times where I go back and re-listen to our recording, but I think we need to change what our policymakers are asking so that they know what to do with the information that we are providing to them. And, you know, so for the panel and for others on the call, just curious if that resonates at all. But I'm tired of living inside the big box. I'd like to get folks to realize our communities are the box that we're trying to work within. So it's 100% of the data when we're looking at data. That was not meant to silence you all. So please come back.
I put a question in the chat, and I'll speak to it now. I am curious about how these stories and data are being used to change people's understanding and perspectives on systems that are oppressing our most vulnerable folks and most marginalized community members. And I'm asking that question because I want to better understand how the process looks and how I can be involved in some small but hopefully meaningful way. So yeah, if there's any answers to that, I would love that. I put a much longer piece in the chat, but I realize it's way too long. So.
Can I jump in for a second too? Jessica, I just wanted to say that I work at the ARC of Whatcom County, and we're a United Way agency here in Whatcom County as well, and work with people with developmental disabilities and children with special health care needs. And United Way changed to a funding program recently that looked at, we needed evidence-based practices in our programs that were showing that there was economic advancement or increase for families and in economic stability. And as an agency, we loathe taking demographic information because it's a barrier to talk to somebody and ask them, what's your income? Where do you live? What's your race? What's your ethnicity? How do you identify gender? We don't do those sort of barriers for somebody accessing services and support in a relationship that, you know, that works. And so when United Way started this, that's when I found that Stanford study, that Stanford Institute that talked about economic mobility, but has, I don't know, 25 different ways of looking at it that are related to choice and self-determination and meaningful contribution and relationships in community. And instead of asking people and talking to them about financial stability and meeting the oppressive nature of that project, we were able to talk to people about, how do you feel your life is changing? Are you able to access more services? Do you feel more connected in your community because of how we've connected and supported you? And so, you know, I had some tools that I could use to try to push back on that and to try to help all of my colleagues here in this agency and in our board of directors to see and feel and honor that. And also I got to put it in black and white and give it to United Way and say, we hear you and this is how we're going to do this work with dignity and respect for people. And so that because we have a relationship, and that's what really is important for me, is recognizing that. So I'm very invigorated by hearing everybody today. So thank you.
Thanks, Beverly. And I know Ara's hands up and just had a question, but we are at time. So I just want to wrap us up real quick. And we normally stay on about 15 minutes after and keep having a conversation. So if our panelists are able to stay, we would love to continue. But I just really, really want to express so much appreciation for this conversation and our panelists. This was really incredible. Elizabeth's going to be putting a link to our post survey in the chat. So if you can tell us what you thought, and if you have any other ideas, please take a moment to do that. All of these resources that were shared and this recording will be on the resource library for you to access and share out. And we usually send that in a follow-up email as well. So again, just want to send so much appreciation to everybody and to all the participants for engaging. If you have to jump off, we totally understand, but we do hope folks can stick around as we continue this for maybe another 15 minutes. And then I will let Ara jump in if she's still around.
I'm still here. Y'all think you can get rid of me that easy? So go. I got a few chuckles. Yay. Okay, so I'm still caught up in my initial question on how we can support individuals and organizations that don't necessarily have that power to hold their organizations accountable. And so one of the things that Northtown ACH just sent out was y'all are looking to start I'm just going to call it a support group for DEIB professionals. I'm calling it a support group. And so one of the things that had popped up in my mind is like, well, if that's a group of DEIB professionals, one thing power listens to is power. Why couldn't we create a network of like agency leaders, like CEOs, executive directors, board members, specifically for them who have already invested in this kind of work through North Sound ACH? And then open avenues for like, say, staff members, be like, hey, I don't feel necessarily psychologically safe enough to bring this up to my organization, but I want to submit, like, maybe I can talk to y'all and it's like anonymously, be like, I'm having kind of these issues. I was wondering if collectively you as a group who hold power within your other organizations could gently like push other like leaders, be like, hey, we want to invite you to this to learn more about it. It's like, it's a group of just like directors and folks, like high level, like management leadership. So in that way, because power holds power accountable. And that's my perspective on things. So, and it can be really overwhelming and lonely. And as much as I love Amy's suggestions, it can be really scary. It's like, well, if I say something out of place, I'm going to get fired, or they're going to quiet fire me, right? Slowly pull away my responsibilities, make it really difficult for me to be in this organization. But if, say, another CEO, executive director addresses another one, hey, we want to invite you to these initiatives. We can help you come up with things. Maybe in that way, that's a way to hold other same level folks accountable. So just an idea I wanted to throw in there, spaghetti at the wall. But it came up while I was listening, so I wanted to share it.
Looks like you have your first couple of like group members popping up in the chat.
You know, Ara, as you were talking, one of the things that I've been thinking about, and I'm new to the North Sound ACH, to being in this space. This is my first year, and I was thinking about the information about the demonstration projects that came out, and I wonder if there's an opportunity there. You know, I always think about funding, right? Like, it's a lot harder for an organization to say no to something if there is funding available for it. And so I wonder if there's something that we can play around with, or a proposal that we could be putting together for that. Like, you know, that maybe that's something we talk about at our next measurable equity group. Is there a demonstration project we could put together? What do you think, Liz?
Liz says, oh my God, I sure hope so. Yes. Does that help?
This is Katie with Ideal Option. I was already talking with Yuki about that exact same thing. Like, how can we maybe look at a way to look at data differently in real time? So I think that, and I'd love to talk about that at the next equity cohort meeting.
And I think part of that, like one of,
I was just going to say, I hope Megan has that down for our next meeting too. I don't see her, so I'm just, oh, there, she's still here. Great. Go ahead, Amy.
Just saying that as we think about the data piece of this, I think also like how are we resourcing the process that we were talking about with the community centered, you know, how are we not keeping this just within our agencies? Like, what does that actually look like? Like, I know Jason and I have been kind of shopping around this BIPOC led data action team concept, and if people are like, I get it in theory, like this sounds really good, but we kind of want proof of concept, and we're like, well, we're kind of coming to you to help us create proof of concept. And so just as we think about it, I want to just hold space for both of those. Like, as we're doing our demonstration project, like what is how are we reimagining like how we're doing data, but then also who is, you know, I just keep going back to what my other co-presenters were saying earlier about who is defining what is meaningful, what are the meaningful measures, and how are we doing this work. So love it.
I worked for a certain university for a while that helped doing a lot of the surveys for certain communities. And I think when the questions were made and how they were presented, some of the questions were pointed towards a certain group of people, and that's what they were going for it. I understand that certain data is collected a certain way, but when you're doing such a big community, you're kind of implying that the other community members are not important, or that some of the wording doesn't make sense in a different language. And that became a very awkward moment when you're the one calling these people and like making the surveys happen. Just on a survey standpoint, the wording is very important. And also the training for the people that are doing the survey is very important, and giving flexibility when you're going from the person doing the survey to you creating the questions. If the person's letting you know that those questions are not making sense in a different language. We had 4 different languages. And of course, if you've ever used Google Translate, if you do one way to the other, it don't make sense a lot of the times. So just kind of beware of that. And also the cultural translation from one person to another. Sometimes they don't make sense either. And it's very important to keep that in mind. And also when you're receiving that information back in your data, sometimes you need to put in that the data may not translate the same from one culture to another. So that's very important too.
Leah, I see your hands up, and I'm not sure if it's in response to that comment or if you had a question after.
Yes, and is that okay?
Ah, go for it.
Thank you for inviting me. This is my first meeting, so I don't want to take up too much time, but I do appreciate that last comment, and it really brought to mind a conversation that I heard when I was listening to a presentation last week at the Washington State Public Health Association, and she was talking about focus groups and really spoke to the need to have appropriate languages, and also people who speak the language delivering specific focus groups. But then there was a weird question around race ethnicity, requesting the race and ethnicity of participants and surveys, but and also focus groups. And it was a rural conversation in Eastern Washington, but I think it kind of applies in my experience to some areas around here in the North Sound, where there is even the reluctance to gauge and ask people about what their race and ethnicity is, and also not a clear understanding of why it's important to ask. And so that is sort of the baseline of presenting data that can be used to look at disparities as having correct identifiers for race, ethnicity, and any other specific factors for folks that you really want to dive into. And so how do you even sort of address that? Because that's the starting point, and it seems like there's reluctance to even talk about that. And it's a challenge with just data sets we get from the state.
Any of the panelists want to jump in?
Oh, sure. I can jump in. I just put in an example of REAL-D, which is race, ethnicity, language, and data. It's a state-led initiative that was inspired by and supported through community-based organizations to create a standardized way of how we collect these data. The legislation passed in 2013, and it's taken 10 years almost for us to just even get to a place where agencies across our state are like, okay, we'll use it, or we'll consider using it. There was a mandate to use it during COVID in Oregon. So we do have about 6 months of data that use this form, but lots of trainings around how you collect this kind of information. Similarly, I'll share the Data Justice Act just passed in Oregon, which requires a similar process around sexual orientation and gender identity. So there'll be a similar process in our state that creates this statewide thing. So hopefully soon our entire state will be required to collect this type of disaggregated data, and it goes through a community rules making process every 4 to 5 years. So I know that doesn't answer your question, but creating a statewide approach or pushing legislation, maybe partnering with some folks in Seattle and Tacoma who may be able to push advocacy efforts. This has been a tremendous thing for us to rally behind to create some sort of standard across our state.
Having been there when the legislation was passed, it's really interesting to have you say it has taken 10 years. Because I do think that culture change that I think I'm hearing from Leah of like, what does it take from idea to making this real? It's nice to know it didn't get lost in the 10 years and it's becoming real, right? Because it takes the work from 2013 forward to get to what you've just described. And that work is just pretty amazing. Thank you. God, I'm so excited to see that and hear that that's happening.
And I'm going to jump into, because one of the things about Real D was that, yes, we did collect disaggregated data during the time of COVID, but really what it required was a coalition of folks, including myself and Dr. Lopez and Dr. Mohsini and a group of 10 plus other people to say, hold on a minute, we're hearing from local counties that you're actually not collecting disaggregated data. This piece of legislation was passed in 2013. It is actually a mandate through the Oregon Health Authority that all OHP and health-related data is collected this way, and that is not happening. And so we got together, we ended up writing a letter to the Oregon Health Authority advocating that folks actually did use these forms. And a lot of folks, and I certainly don't blame the contact tracers who had, I'm sure, lots of work to do, were saying, hey, we feel uncomfortable, we don't really know how to ask these questions, et cetera. But at the end of the day, what that did was it actually, we spent more time not understanding the communities who are most impacted by COVID-19, deaths and hospitalization rates, because we didn't have those data collected, even though 10 years ago we passed this piece of legislation. So, I think that it's always really important for advocacy groups to recognize, not recognize, but to be doing that work to continue to advocate for the implementation of these policies and practices, because, they're really only as good as they are implemented. And oftentimes they don't get implemented in ways that even the intent of the bill was. So, I think it's really important to name that and to really thank you, Dr. Lopez and Dr. Mohsini, for being part of that work too, because, I think we probably gathered thousands more data that was actually disaggregated based on those advocacy efforts.
And they still haven't analyzed it either. So all that data on race, ethnicity, language, disability is just sitting in a database for years of knowledge that we have, and we'll see how long it takes. But we do have friends in those offices trying to work towards that. But I also wanted to share that because lots of work to do.
We've done our 15 minutes, so I do want to wrap up so people can get back to, I'm sure, other meetings. But I just, again, want to thank Jason and Amy and Andres and Mira for this. This was so valuable, and I think we could probably keep going for another hour and a half. So thank you so much for this. I really appreciate the conversation. And thank you everyone who stuck around to chat more.
Thank you, everyone.